Waking up once, twice, or 3 times tells you how often the night was interrupted. It does not tell you why. The clue that matters may be the amount you pass, what woke you, what your stream does, how quickly the pattern changed, or what appears with it. For men over 60, those differences can separate a pattern worth recording from one that deserves prompt medical attention. This video will walk through 7 nighttime urinary patterns in increasing order of importance. The first 4 help you understand the mechanism. The last 3 change how quickly you should act. And the final pattern is not about how many times you went. It is about what happens when you urgently need to go, but cannot. One warning before we begin. A pattern is not a diagnosis. The purpose is to help you recognize useful information and know when observation is no longer enough. You open your eyes at 2 a.m. Perhaps a noise woke you. Perhaps your shoulder hurts. Perhaps you were too warm, your mind was active, or your sleep simply became light. Only after you are awake do you notice that you could use the bathroom. That sequence matters because the bladder may not have caused the awakening. Sleep disorders are one of the recognized categories associated with nocturia. European urology guidance also emphasizes that nighttime urination often has mixed causes, rather than one clean explanation. Here is the test. When you wake tonight, pause for a moment before getting up. Ask, did urgency pull me out of sleep, or was I already awake? Write A for awake first and U for urgency first. Do not force yourself to remain in bed if you need to go. This is observation, not a contest. Why should you not ignore this pattern? Because treating every awakening as a bladder event can hide a sleep problem. Loud habitual snoring, witnessed pauses in breathing, gasping, morning headaches, or marked daytime sleepiness are reasons to include sleep in the medical conversation. The next pattern looks almost identical on a bathroom trip count, but the amount tells a different story. Imagine 2 men who each get up 3 times. The first passes a few ounces. The second passes a substantial amount on all 3 trips. The same number is hiding 2 different patterns. When nighttime amounts are repeatedly large, your body may be producing a larger share of its daily urine during the sleep period. Clinicians call this nocturnal polyuria. That can relate to fluid timing, alcohol or caffeine, medicines, sleep apnea, leg swelling, or medical conditions involving fluid balance. It cannot be sorted out from one symptom alone. Notice whether evening ankle swelling is lower by morning. Notice whether the large nighttime amounts follow a specific evening routine. Record the medicines and supplements you take, but do not change their dose or timing without professional guidance, and do not respond by barely drinking all day. Extreme fluid restriction is not a safe, universal solution. A frequency volume chart is more useful. Record when you drink, when you urinate, and the approximate or measured amount. European urology guidance says these charts provide real-time documentation and reduce the errors that come from memory. If the amounts are consistently large, bring the record to a healthcare professional. The important question is not simply, is my prostate enlarged? It is, why is so much urine being produced or released during my sleep period? Now, reverse the pattern. What if the urge is strong, but the amount is small? You wake with a sudden need to go. You reach the bathroom, but pass only a small amount. An hour later, the same thing happens again. That pattern brings bladder storage into the picture. Urgency and frequency are called storage symptoms because they concern how the bladder holds urine. They can occur with several conditions, and they may coexist with prostate-related obstruction. The symptom does not identify the cause by itself. The practical clue is repetition. One small void after an unusual evening means little. A recurring cluster of strong urgency, small volumes, and frequent trips gives a clinician much more to work with. Record whether urgency appears only at night or during the day as well. Note leakage, burning, pain, and whether the change is new. If this is the pattern you recognize, comment with the word small. If your nighttime amounts are usually substantial, comment large. You are not diagnosing yourself. You are learning to describe the pattern. The next pattern is where the prostate becomes more relevant. But even here, one symptom is not enough. Nighttime urination by itself does not prove that an enlarged prostate is causing the problem. But the conversation changes when it appears with trouble starting, a weak or interrupted stream, straining, dribbling, or the feeling that the bladder did not empty. The prostate surrounds part of the urethra. As it enlarges, it can narrow that passage. The bladder may have to work harder to push urine through. The NIDDK lists nocturia, urgency, frequency, trouble starting, weak or interrupted stream, dribbling, and difficulty emptying among symptoms that may occur with benign prostate enlargement. But there is a crucial limitation. Symptom severity does not always match prostate size, and similar symptoms can come from other urinary problems. That is why the cluster matters more than the label. Ask yourself, has starting become slower? Is the stream weaker than it was several months ago? Does it stop and start? Do I still feel full when I finish? If several of those changes appear together, discuss the outlet and prostate with a healthcare professional. If you also want to review a nutritional option marketed for prostate support, I place the full presentation in the description and pinned comment. Review the label and the manufacturer's claims for yourself. It is not being presented as a treatment for nighttime urination or as a replacement for medical evaluation. The channel may receive a commission if you purchase through that link at no extra cost to you. That is especially important because the next 3 patterns should move your attention away from shopping and toward timely evaluation. Many men say, "I'm over 60. This is probably normal." Age can change urinary patterns, and benign prostate enlargement becomes more common as men get older. But age should not erase the timeline. There is a difference between a stable pattern you have discussed with a professional and a clear change over days, weeks, or months. Maybe you went from 1 trip to 4. Maybe urgency appeared suddenly. Maybe the stream has become progressively weaker. Maybe you started leaking without warning. Maybe the symptom now changes travel, exercise, or sleep. A change in baseline is information. NICE guidance recommends assessing urinary symptoms, reviewing medical history and current medicines, and using a frequency volume chart when symptoms are bothersome. The goal is not to assume the worst. It is to stop using age as the only explanation. Use a 3-day record. Time of each trip, amount passed, urgency or awake first, stream strength and emptying, evening fluids, swelling, medicines, pain, fever, or blood. Then write 1 sentence at the top. This changed around. That sentence can be more valuable than a long, uncertain memory. Subscribe for the rest of this series. We will turn these observations into specific questions for your next appointment and show you the bedtime water mistake many men make after one bad night. The final 2 patterns are different. They are not simply clues to track for 3 days. If urinary frequency or urgency appears with fever and chills, if you see blood in your urine, or if you have significant pain in the lower abdomen or urinary tract, contact a healthcare professional promptly. These combinations can occur with problems that require evaluation, including infection and other urinary conditions. A video cannot distinguish among them. Do not assume blood is just the prostate. Do not cover fever and painful urination with a supplement. Do not wait for a 3-day chart to become complete when symptoms are severe. The NIDDK specifically advises prompt professional attention for inability to urinate, painful, frequent, urgent urination with fever and chills, blood in the urine, or major lower abdominal or urinary tract discomfort. The action here is simple. Seek medical guidance. And pattern 1 is even more time sensitive. You feel that the bladder is full. The urge may be intense. You try to urinate, but nothing comes out, or almost nothing comes out, especially with lower abdominal pain or swelling. That can be acute urinary retention. The NIDDK describes inability to urinate and often severe lower abdominal pain as symptoms of acute urinary retention. NICE guidance calls for immediate catheterization when acute retention is present. For the viewer, the message is not to identify the treatment. It is to recognize that inability to urinate is an urgent medical problem. Do not drive yourself if pain or your condition makes that unsafe. Seek urgent medical care or emergency assistance appropriate to your location. No supplement CTA belongs here. No hydration trick belongs here. No wait and see belongs here. This is why the list had to progress from observation to action. Some patterns help explain the night. Others change the clock on getting help. Here is the complete map. If you wake first and urinate second, include sleep in the picture. If amounts are repeatedly large, include nighttime urine production and fluid balance. If urgency is strong, but amounts are small, include bladder storage. If the stream is weak, hesitant, interrupted, or incomplete, include the outlet and prostate. If the pattern is new or worsening, record the timeline and arrange a conversation. If there is blood, fever and chills, or severe urinary pain, seek prompt medical care. If you cannot urinate, treat it as urgent. The useful model is not, how many times did I go? It is, what pattern did those trips create, and what action matches that pattern? For the non-urgent prostate-related pattern, the nutritional prostate support option I mentioned is linked in the description and pinned comment. The link takes you to the full presentation rather than directly to an order page, so you can review the product, label, manufacturer's claims, and terms before deciding. If you use medication or manage a health condition, discuss adding any supplement with a qualified healthcare professional. That option may be part of a decision. It should never replace understanding the symptom. Share this video with a man who only counts bathroom trips. The details around those trips may be the information he actually needs.